Just so you know, we are now being recorded.
I'll just sign. I felt so good, but I really didn't need to. You always ask. I'm always happy when I can successfully do anything. Thank you. Okay, it's 2 o'clock. Can we call the meeting to order? And I don't know, Mike, do you want to tell them the email that you received today, or do we want to wait further down in the program?
It's up to you, Madam Chair. It's up to you. I'm loud. Shut that off.
We might as well do it now.
We'll shut that off because I don't need a microphone.
No, you do not need
Yep.
a microphone. I sent an email today to Mike Ellis and the mayor. I am resigning from the Council on Aging as of tomorrow. So, I guess Ron has a new job.
I guess.
I've given it much thought and prayers, and I just feel God wants me to move on in another way. So I will be leaving. So I don't know if you want Ron to proceed with the meeting or what.
Well, I think the email said effective tomorrow, so if you'd like to serve as chair today, that certainly would be at both your pleasure. You're still a member of the council, so are you willing to serve as chair for this meeting?
I am
Okay.
willing,
Yeah.
or whatever.
Let me just say, even though it's not part of the agenda, Sandy, I really do appreciate your service to the Council on Aging and our seniors. And I hope you know that as you continue on with your service in so many other areas. And I hope we can count on you to continue to provide the input and the support that you have so graciously given to the Senior Center, the Council on Aging, and to our community. And we very much appreciate it, so thank you.
I will pass my notice around, and I will continue. It's just, I've been thinking about it and praying about it, and the Lord finally gave me an answer. So, things happen in life. But, has everybody had a chance to read the minutes from last month's meeting? Any comments, concerns about the minutes? I did notice a couple typos, but we won't worry about that.
And if there are typos, I'm responsible for all of them.
His fault.
I own
He
them.
revised them. He's revised the,
Well, spell check has a terrible way of doing things, but it's not, they were not major.
One of the interesting thing about the minutes is with the video now, we're able to much better look at the record of the meeting and transcribe the minutes rather than relying on people's notes and memories. So I think that works out great. Kathy, I again really appreciate you putting the body together for me. It was great. Do it next time. Thank you.
I have one thing. Acceptance of the minutes of the previous meeting, second by Audrey O'Shea, but then up here, associate members absent, and she wasn't, so we got the list of there.
Okay, that's the type. So in the minutes.
she's under associate.
Oh no, she is. Yes, no, she is present.
She was here last month.
Well, she's listed as absent,
No,
No,
Gloria.
she's under
and every-
associate members.
but she's not an associate.
Audrey's,
A regular
well,
member.
her term is expired, but
Right, now,
but she is actually a board member, she's not an associate.
Oh, she's a board member?
Mhm.
I never knew that.
Yeah.
So we misclassified Audrey, and certainly I didn't see that either. So Audrey should be classified as being present under the board members and not the associate members, but she is indicated as being present. So, yeah. So if there is, Madam Chair, when you call for a vote, we'll have to do it as amended, as opposed to as presented.
So can I get a motion to accept the minutes of the last meeting with the necessary corrections being made? A second.
I'll second.
Can we have the treasurer's report?
Just,
I need to,
just order of business. The motion has been made and seconded, but a vote has been taken, so we need to have the
We
board
need
vote.
to have the board vote on accepting the agreement.
Aye.
Disagreement? Seeing none. We'll move on to the treasurer's report.
Nope, should be on, just,
All right, well, thanks to improvements in the city's system and thanks to help from Mike Ellis, we now can report our budget report up to date. Before, when I had to wait for the figures from the city auditor, they got them about the 15th of the month, and then I couldn't present them to you until the following month, so we were always a month behind. Now, we are right up to the minute, which is really, really, really nice. And we designed, I got a little input, but Mike is the whiz on the computer, but between the two of us, this is a really nice, I think, a really nice budget report. You get the first, if you go to page 1 here, the general fund, you can see what the city has given us for 2022, and it all goes right down, department head, clerk, custodian, da-da-da. And then, through August, that's what was spent for all those items through August. Then through September, and all those items. And then, the next column is just the individual figures, just for the month of September. And of course, they are included in the through September. And then the final column is what we have remaining to carry us through to June 30. And I think we're in very good financial shape, $159,947.
so point of clarification, I'm sorry, Terry,
What did I do?
we did change the report a little. That 159,000 was what we actually spent last year. So we're comparing
Oh, okay.
2021 final to 20, to our current capacity,
Oh, okay,
Yeah,
I'm
so
sorry.
that's
Then
just the final
then
number.
the September 21 column is what we.
Just the month, the
The month.
last 30 days.
Okay. And then, of course, the revolving fund, you all have asked and been told that that's the money that comes in and it goes out for various things. And it was a fund that was established by the city council quite a few years back, and that's in good shape right now. And on the back of the thing is your gift fund. That's in very good shape right now. And
Yeah, just a quick note on the revolving fund. Even though, we've spent a lot on instructors and things like that, we're still left $300. So, we try to, I'm a little bit fiscally conservative, although there are things we need and we're buying, but we try to do that, keeping in mind that there's a finite amount of money. So it's $300 ahead of where we were a month ago.
And then finally, the gift account, there's been no money in or out there. The state grant, which, that's in very good shape. And a lot of things are bingo, instructors, and elevator generators, they come out of there. The state grant, and one thing to notice, as Mike and I were doing the thing, we forgot that sometimes the repairs, he reported 3609.45 in repairs, but it's repairs that were made or going to be made, and the money is encumbered. So the actual cost for repairs was only $743.79. In the future, you will see the rest of that money being paid out. So that's the difference between that and what was actually spent, but it's the money that's encumbered to pay for repairs that are either made or being made or will be made.
That's an important thing, is the cash isn't out, but a contract and PO have been signed.
It's been signed.
So we put that money aside.
Right. And of course, the state grant is pretty much in order. In September, we reported $398 for elevator generator expenses. And, but the actual expense through August was $198, and so in September, we reported the full amount, which included that 198. I think I said that right. And one other thing, with the city, with the city being more online, and now the bills are being, the city has a system called Munis where they pay the bills, and our senior center is now making more use of that, and all the bills and all the payrolls and everything are going through Munis. So, in a moment's time, Mike can bring up everything, which wasn't the case before, but now it is. And another thing that the city is working on is that in the future, we're not sure when, but when you want to sign up to go, say, to the barbecue and the cost is $20, you may be able to sign up online and pay your $20 online. But it's in the future, but it's being worked on. And
Is there going to be a fee?
Yeah, there is a fee. Anytime you use a credit card, there's a thing called a discount rate, but it's really a fee that's charged to the broker. There are two ways to handle that. We can either absorb it into the cost or pass it on to the consumer. The discount rate for the merchant account on my senior center is about 38 cents per $10. So it's really, relatively inexpensive. There's probably no reason why we shouldn't build that into our cost of programs. We can easily absorb 38 cents into that. Right now, we are currently active on My Active Center. So if you Google the Gardner Senior Center, My Active Center, the Gardner My Active Center, you'll see a list of all of our programs online now. It's now active, it's now running, it's vibrant. So you could sign up for yoga, you can sign up for the bread raffle, any of the existing, our concert series, you can sign right online. You don't have to call the office and do that. A lot of our folks prefer to have that personal touch, and we do too. We love to talk to our members and talk about what's going on and say hello. But for some folks, it's very convenient to just go in and sign up for 8 weeks of yoga and get it done. We don't have, as Terry said, we don't have the merchant agreement signed, so we do not currently accept credit cards. But our hope is within the next month to be able to offer that as a value-added service to our seniors for those that want to take advantage of it. And for those that don't, we love to see your face and interact with you, so that's always an option. I do want to just make mention of the notes that Terry said, because they're really important. When we reported last month, and it was one of those nuances, we captured the report as of September 10th. Anything that was paid from September 1st to September 10th was captured in that report, even though it was considered a September expense. So that's the things for like the credit card expense that we reported out. We didn't capture the $75 refund. So it showed $300 expenses without the refund. With the refund, it was $225, which is the more appropriate one. The $3709 for instructor expenses included about $1,290 of expenses that were actually incurred in the month of September, not August. So it looked like it was higher than it was. By the way, those numbers are actually reflected in the through September figures on your report now. So it's not like they've disappeared. They're just showing up in a different period. And the last big one, Terry talked about the general expense. The big one was the outreach coordinator. That was actually when it was set up. We set it up last year, but we never hired anybody last year. We didn't hire them until the beginning of this year. So the outreach coordinator's salary was allocated to the 2021 grant expense. Well, the 2021 grant is closed now, so we didn't see those expenses. It's been reclassified into 2022, so now we'll see those expenses in real time. But other than that, those are the only, major, not the only, they are the only significant changes. And Terry was kind enough to spend time with me this week, and through our work together, we were able to identify those glitches.
And I think that going forward, now that we're into September, we go month to month, I think that we're going to be really smoothing right along.
I don't think we've ever provided this detail of
we never have.
information to the board, so,
Never.
we're really trying to be transparent and to get collectively your, your feedback and thoughts, especially if you find something that may be awry.
Another thing I would like to mention too, all money that comes in, all cash that comes in, say from the yoga class or the pool room, the instructor or someone brings it up to the office, it is double counted by 2 different people, and then it is logged in. So just want to assure you that there is no misappropriation of money.
Yeah, money really can't go missing now.
No.
And John Richard, our auditor, was very appreciative of the fact that we've started to build in checks and balances in some of our operations. I think the council did a very good job, and the senior center did a very good job managing that in the past. We're just adding a few more stopgap measures to protect the financial and service interests of our seniors.
Yeah, I think so. I think it's, very good, yeah.
I'd just like to make a note to thank you, Terry, and to thank you, Mike, for bringing this up to date.
Yes.
I think that's wonderful.
Yeah, oh, it is, and we'll be up to date from now on.
Of course, I'm a critique, so I don't see why we can't change the revolving fund in agreement with the general fund as far as the categories.
Yeah, I agree. When we set it up, so we,
Because I looked at it.
it's if you notice what Sandy's saying, I totally agree, because it's something we captured too. We figured for this month we'll keep it the way it is, but next month we'll change it so that the columns line up with each other. In the general fund we put budget through August through September, and then just September. And in the revolving we did through September through August, and then just September. So we'll change those columns around.
Thumbs up for your first round.
Yeah, it's not bad, not bad.
We're a work in progress.
I'm just curious on the gift fund, where did the increase come from?
The increase in the gift fund,
Hmm.
so in the 2850 last year, oh, I did have detail on that too.
Yeah, I mean, I'm looking at the 48,625 to the 49,835.
Well, yeah, so that's probably,
The gifts that might have come in that weren't reported.
yeah, I will clarify that for the next meeting. So for purposes of clarification, in the 2021, we show an ending balance of 48,625.43, and in the 2022, we show 49,835, which is about $1,210, if I have that right. So we'll try to show that. It might have been just simply a...
And it doesn't look like the total for 2021 adds up either.
No.
But that's all right. I'm sure it's just a matter of some miscalculation.
Yeah, and a lot of these are formulas, so it
Yeah.
might have been the formula wasn't quite right on the gift fund. But we
Just
do know for
clarify
sure
your fund.
the balance is 49,835.
Right.
That's a given. So,
Yeah.
we had to backtrack and try to reconcile each of the accounts for 2021. It is not a difficult process. John and Jackie have been unbelievably supportive in helping us do that and go through what is a beautifully recorded financial transactions. It's just a matter of, really trying to get to the income categories and expense categories. But we know the bottom line right now, our gift account is at 49,835. We did absolutely verify that.
Perfect.
And as we said, it's a work in progress, and we're going to fine-tune it even a little more for next month. But it's really much better than what we had before. I mean, it's so much easier now, but everything is, you come into the senior center and access the accounts, and whereas before we were getting them a month later. And so this is so far much better.
And just to get it on the record, I'm going to quickly just throw some numbers out for the recording and for the minutes. Through September, in the general fund, we spent about $38,494.91. In September, our expenses in the general fund, those categories that are funded entirely by city budget, is $11,082.47. On the revolving fund, we had a beginning balance through September of $23,531.78. We took in, through September, $4,741. We spent quite a bit. I don't have a summary. It's like $3,665, something like that, with an ending balance of $24,727. For the month of September, we took in $689 and spent about $500. So that gave us a balance of $261. On the gift fund, our balance is $49,835.43, and on the state grant, again, that's 33, 34, 36. We spent about $3,800. Had $59,000 to start, and we have a pretty good balance right now on that account. All right, with that, folks, that's the finance report. Any questions for Terry or I? And Madam Chair, we need to accept the treasurer's report.
I motion to accept the treasurer's report.
I'll second it.
And the board in agreement?
Aye.
Okay, the treasurer's report has been accepted as written. Now we'll move to the old business.
So, at your pleasure, Madam Chair, I just want to let you know that we are scheduled for our COVID and flu vaccine on October 20th. As reported in the last board meeting, we are providing booster shots for Pfizer vaccine for folks 65 years of age and older, and third dose vaccine for both Pfizer and Moderna for folks that meet one of these medical conditions. The COVID clinic will run from 9 a.m. to about 3:30 on Wednesday the 20th, and that's sponsored by Community Health Connections, the Gardner Community Health Center. In addition to them providing staff and volunteers from the Senior Center, Dr. John Mulqueen, retired pediatrician from Gardner, Dr. John Harrington, a primary care physician from Gardner, and Dr. John Skripczak, who is a general practitioner and ran the ED in Gardner, will all be vaccinating along with a bunch of other great people and volunteers. If you are interested and willing, we could certainly use your help. So if you're willing to do traffic detail or scheduling detail, please let. It's going to be held at the old Sacred Heart School, Chair City Church. And we want to make sure, Gloria, that was so appreciative of that question, that we send out our appreciation to Chair City Church and their continued commitment to community service. They were quite willing and ready to accept our request to use their facility and have been so gracious and accommodating. So we thank Chair City Church for that. So that's going to be right on Central Street, or if you're coming from West Line Street, on West Line Street, the old Sacred Heart School Auditorium. The flu clinic is being sponsored by Walmart Pharmacy. The flu clinic will go from 12 to 3:30. They're providing all the vaccinators and vaccine. So looks like we're going to have a robust...
All on the same day.
All on the same day. And for flu and COVID vaccines, you can actually get both of those the same day. There's some discussion about whether you can get shingles or not. There's no prohibition, but the general recommendation is that you wait to get your shingles vaccine. We were going to do a shingles vaccine that day. We will not do the shingles vaccine that day.
Now, the booster is only for people with conditions, not 65 or older.
It's a little funny. The booster is 65 years of age or older.
Oh, it is.
And the booster is given after, at least 6 months after your second dose.
Yeah.
So if you've had Pfizer and you got your last vaccine in March, you're eligible for a booster for Pfizer. Moderna hasn't been recommended for a booster yet. However, third dose for both Moderna and Pfizer are recommended for folks that have a significant medical underlying condition. So if you meet, some of these, like you receive active cancer treatment, you're taking a stem cell transplant, or taking medicine to suppress the immune system, have a diagnosed autoimmune disease, those are the types of things that would make you qualify for a third dose, which can be administered anytime after 4 weeks after your second dose. So,
So is that, in essence, a booster, a third dose?
yeah, so the reality, and it is meant to confuse people, the booster and the third dose are exactly the same medication, it's the same dose, so if you get the Moderna third dose or you get the Moderna booster, it's the same. The semantics are in the time and the eligibility. A third dose is given as soon as 4 weeks after the second dose for people who are immunocompromised. A booster is given 6 months or longer after the second dose.
Oh, geez, that's confusing.
It is confusing, yeah. But the real thing to the qualification is about eligibility. If you don't meet one of the medical eligibility, you're not eligible for the third dose. But you could be eligible if you're 65 and older, and it has been at least 6 months since your second dose, to get the Pfizer,
Oh,
the
my
Pfizer
God,
only.
is that
There is
confusing?
no Moderna booster shot that's been approved yet. We thought, we kind of expected it would be by now.
No, I already got it at my doctor's office.
Yeah, the Moderna? Yeah, so you got a third dose.
Not
It's
Moderna.
not approved.
Moderna hasn't, they
Yeah,
haven't
yeah,
got
I
it.
get it.
Moderna third dose is approved for
Yeah.
autoimmune or
Yeah,
other
it's
compromised
legal,
people,
but my doctor hasn't given it out yet.
but not the booster, right?
Dr. Muchler did, Dr. Parker, and,
Muchler hasn't given it out yet.
yeah, that's where it is.
I went to Walgreens.
And you had Pfizer.
It's
I had
Muchler.
Pfizer, they gave me the shot, and they also gave me the flu shot.
You must have had some reason.
Oh, yes, I'm on a medication that qualifies.
Yeah, see, yeah, that's why they haven't contacted people yet.
Yeah.
But now, what about the people who got the shots through the senior center at the school? You'll be notifying them when they're eligible to get the,
Yes, so folks that got their shots through the senior center got Moderna. So we're notifying everyone now that we're doing the booster shots for Pfizer and third dose for eligible Moderna vaccine recipients.
That's the cool.
But that's a general announcement. We're not calling everyone to ask them because generally that ends up resulting in a lot of confusion.
Yeah.
So if somebody is immunocompromised and they would like the third dose of Moderna, we can get them, we will have a supply of Moderna for third dose, but not for boosters. So if you're not immunocompromised, there's no recommendation to get a third shot of Moderna.
but when
Have to make
it
an
does come
appointment
out,
for
you'll be
this,
able
or
to do
just
that
walk
then.
So 2 questions, let me answer yours first. The answer to that, it is by appointment. We're doing appointment slots just like we did for the first round. We're gonna do about 12 people per 15 minutes. I say about because we'll increase that if we have folks looking to do the Moderna third shot. But right now, we're set up to do 12 Pfizer booster shots every 15 minutes. So folks, if you're watching and you're interested and want a shot October 20th, call the senior center and we'll get you an appointment.
You can make appointments now.
Yep,
This
yep,
is
we
my
opened
wife.
it, on Friday.
She can get the third shot because she's cancer.
Yep.
So,
Yep, appointments are now available for both the flu and the COVID vaccine. And for the COVID vaccines, both Moderna and Pfizer. I'm sorry, Sandy, you had a question too.
Well, yeah, my question is when the Moderna comes out officially for the boosters, then you'll notify those people?
Absolutely. Yep.
That's the main concern I've got, is because people who had it at the school say, well, how am I gonna know where to get the booster? And I
Yeah.
assured them that you would be calling them, or letting them know somehow what they would be knowing.
Most
And I'll follow up
clinics
too.
are not doing third dose or boosters. Most clinics that did first and second have decided to not offer the booster or third dose
Haywood's not gonna do
clinic.
it.
So yeah, Haywood, you won't see a PACC clinic. That's why we're doing it for our seniors, 65 and older. We'll do the same thing for Moderna, but I think it's important to note, Sandy, because you raised a good question, that you can get the Pfizer vaccine now at the pharmacy. You can get it through your doctor's office. And if somebody's really concerned and wants the Moderna third dose, they can contact the doctor's office. We will make that available when it becomes approved by the FDA,
Right.
but there's, as Sandy said, there's nothing in the works right now. They haven't even put in an application, so that may be some time.
Oh,
Johnson & Johnson just did theirs today.
yeah.
They got approved?
No, they just submitted theirs.
Oh, yeah, yeah.
Johnson & Johnson. So,
It is confusing.
Flu vaccine clinic going to be held where?
The flu vaccine clinic's gonna be held at the same place the COVID vaccine clinic is.
All
So,
the same?
yep, we're scheduling folks, so if they wanna have both, we'll schedule them for both. If they wanna have one or the other, we can schedule them for one or the other. But all of our vaccinators will be at the same place, at Chair City Church on the 20th. Thank you.
very good. We'll be glad when COVID-19 is over.
Yeah, and for you folks that weren't part of our clinic, well, you saw, if you were part of the PACC Haywood Clinic, you knew how, very detailed and, very intricate the planning was for this. Similarly for our clinics, we had a lot of volunteers, a lot of vaccinators. There are a lot of moving parts. It's a heavy lift to do a clinic. It's not easy. So, not only do we have to make sure there are people, we have to make sure there's product, that there's all of the equipment necessary to vaccinate, that we have vaccination rooms, appointments, that there are folks there to check people in. There's a pretty elaborate registration process. We go through a health questionnaire on the day of registration, and we do a health questionnaire when people come in that day, just go over it with them. So there's a lot to it, and our staff and volunteers have been incredibly helpful and are on top of this. So we're so appreciative of all the folks who helped really make things work and keep those gears in motion.
The happiest thing was to see the elderly just tears of joy that they could get. That
Lit-
was the best part.
Literally, Sandy,
Yeah.
right? Yeah, people were
Yeah.
crying.
Yeah,
People were crying.
Well, it was so hard to get and
Yeah.
trying to get appointments.
Yeah, it was
Yeah,
just,
it was
they
a
were just
relief
so
for them.
appreciative. And they still are to this day.
Yeah,
They
yeah,
really are.
yeah.
You just want to make sure you bring your vaccination card with you, because they marked down the third one on the card.
Yeah,
That's it.
Yeah, so when we're making the appointments, we're telling people they have to bring their 3 things. They have to bring their vaccine card, their license, a form of ID, and their insurance card. But great point, Ken, thank you.
And if they got the card, the first one, and they had it laminated, they still gotta bring that card, but they'll give you another one separately. They
Yeah.
put a sticker on the back of the vinyl.
Oh, is that right?
Lamination.
Ron, I'm going to just mention this because I think it's important to mention that a lot of folks, since they had their vaccine, have lost their cards. And again, because of the collaborations, cooperations, and relationships we've made, we saved them several steps to get a new card. So we've probably had a dozen seniors call and say, I've lost my card, I'm in panic mode. And we literally just make one call and we'll have the card there in an hour. So, for folks that are watching or folks that participate in this meeting, I want you to know how important the folks from the Community Health Connections and the hospital are in keeping our seniors, comfortable during a time of, I think, accumulated, chronic stress.
Now, do you have to bring in something, like if you get the Moderna and it's the 3rd shot, you have to get a doctor's report to show that you have a reason to get it, or just...
So, like the first shots, when we went through the eligibility, in terms of ages and then medical conditions, we do rely on people's self-reporting and honesty. So the answer is no, you don't have to have with you medical documentation. But know and understand that many of our vaccinators are practitioners in the area and generally can access, your medical record because you sign and authorize them to do so. So we really haven't had a lot of issues with that. I think if somebody is so stressed out that they feel like they need, the booster or the 3rd shot, we're not in a position to really say no to that. We'll let the physicians and the medical people do that.
So
We provided a lot of accommodation, I think Sandy would agree, to folks that, maybe didn't meet the age eligibility, but because of, again, the stress and anxiety or physical conditions, provided them access to the vaccine.
Yeah, I know when I went to Walgreens, they just give you a sheet and you read it. Do you want to, over 65 or, are you?
Check. That's what we
and you
do.
just do a little check on it and
Self-attestation.
sign it. That's all they ask for.
Yeah.
Yeah, that's all we do, Dick. We really base it on people's, honesty and ability to self-assess. Yep. Thank you.
The next is board appointments.
So still waiting for confirmation on this. I know there's been some movement, but I don't know what that movement has been. I haven't been able to connect with Mike on that. So I would just say that it's still pending. We're still pending. However, I'm going to say to everyone here, Maury resigned last month because he's no longer in the area. He's not a Gardner resident, has to serve. Some folks have served a long time and are being called to other service like Sandy. And we want to make sure that we fill those with people that are capable, interested, active, engaged. So we welcome and encourage you. If you know someone or can think of someone you think would be good on the board, we would love for you to kind of mention that to myself and Ron, who's acting interim chair. Now, Ron, I'm going to just tell you this without you getting too concerned by that last statement. We will have to go through a formal process at the next meeting of having the group discuss, nominate, and then select their chair.
And my term expires, because he'll be, I presume, taking over the term of mine. When did yours expire?
Mine will be expiring March.
March. And mine was August of '22.
That's your appointment, not your service as chair.
No, but that's right, but that's my appointment. He'll be basically taking over, I would say, my appointment. So it would be to August. Yeah, here it is, expires.
Yeah, so Ron, your appointment is predicated on what the mayor's appointment was. It ends in March, but that will be renewed for another term.
And now we go to new business.
So I'm not going to give you the huge amount of information I gave you in the last meeting, but there are a couple things I want to let you know about. First of all, this past month in September, we went out to Red Apple Farm, had a wonderful day. And there are a lot of people I want to thank specifically for that program. Our entertainer was David Spades, did a great job. Red Apple Farm was a humongous host, provided us some things to raffle off and give away to our seniors, which was real nice. And the atmosphere was terrific. If you didn't come, you missed it. Just a really beautiful day. A little chilly, it was a little nippy, but not bad, not enough to send people away. We had a great meal provided by the Gardner Ale House of macaroni and cheese and pulled pork. Desserts of creme brulee provided by Baldwinville Nursing Home. And then we were also surprised and elated by a wonderful donation of our medical response bag from Gardner Rehab and Nursing. So what we've been doing in the past, and some of you know, you've been involved or heard that we've had a few incidents. The majority of our incidents, all of our incidents, not the majority, all of our incidents since February have been in the staircase. So the general rule of thumb is stairs do not make well for senior centers, and we have certainly seen that. Some of those have been minor, falls, but we did have at least one significant injury. We've been following up with that senior. They're doing well, and have been following up on their medical care. But at the time, we were literally using old Band-Aids, paper towels to do wound compression and things like that, which is not like a fantastic idea. We recognized and realized very early on that we needed a medical bag, and have reached out to a few people. Gardner Rehab said, don't ask anyone else, that's something we'd like to do for you, and they've donated that. In addition to Gardner Rehab, Community Health Connections donated a first responder bag. In this bag, there are ambu pouches to provide resuscitation, there are ammonia tablets, glucose tablets, and Narcan. So, we have this to kind of respond to other medical emergencies. Between the two, we're like a little ambulance service now. And you may not really consider that significant, but it's huge for us. It just gives us the ability to respond appropriately and quickly to a senior that might be experiencing some kind of medical injury or illness in our facility. So we're very grateful for that. Lots of good stuff happening in October 21st. We'll go into the Plymouth, on the Plymouth trip. We have, let's see what else we have going. We have an elder abuse training for our staff. We have, we're closed on Columbus Day next week, just so you know. Fallon Senior Health is coming in, and at the end of the month, we have Sean Fullerton concert here at the Gardner Senior Center. November is just as robust. We have a lot going on. We met with and talked to the Gardner Elks and Lions Club about our holiday meals. Everything's right on track for that. We're looking good. We're going to be doing, we are going to do pickup, grab-and-go meals again like we did last year. We hope to do them, at least one of them, Christmas meal from the center itself. So we'll talk in next month about closing the center one day early so that we can do a drive-through pickup, grab-and-go in the parking lot. But again, want to thank all of the many financial contributors, sponsors, and donors to our holiday meal program. We couldn't do it without them, folks. I mean, it's the enormity of generosity in this community it just has no ends, no bounds, and we are so appreciative of that. So November and December, we're going to see a lot of holiday closings. Just so you know, November 11th, we're closed for Veterans Day. November 25th and 26th, we're closed for Thanksgiving. That's Thursday and Friday. December 24th, we're closed. December 31st, we're closed. And we will close down the programs early on the 22nd for the drive-through picnic. So that's going to put a little bit of a twist and wrinkle in our programs, but nonetheless, we have a lot of programs. And last but not least, for those of you who didn't know, we have a concert scheduled every month. We have one from July to December. So this month is Sean Fullerton. On November 15th, we have Dennis Cormier coming in. And on December 6th, we have Tommy Grohl coming in. That will be our holiday celebration as well. So, come in your most festive, ugly sweater and enjoy some snacks, libation, non-alcoholic, but some great entertainment in that kind of holiday event. I'm also going to let you know we will probably be doing our staff event that day. So any of the board members that want to participate in that, let me know, and be happy to invite and encourage you to join us for that, or at least stop in and say hi to the staff.
Oh, what does that mean?
We're going to do our staff party, our staff celebration that Monday.
After everybody leaves?
After everybody leaves, yeah.
Well, that should be interesting.
So the interesting thing is it does not include alcohol. However, I am going to just report, I did ask about alcohol at the center because we had a proposal to do an art event, like paint, get a whole class, everybody paints the same scene, and do in conjunction with that art thing, and I think it's a wonderful idea, a wine and cheese event. It's a wonderful idea, but really to do a wine and cheese event successfully, it needs to be at night, and a lot of our folks don't drive at night, and I'm not sure it's great to pair wine with so we may do a non-alcoholic wine and cheese event, and I'm hoping to announce that schedule soon. We have cake decorating coming up in December. I mean, just lots of really whimsical, kind of neat stuff. As you know, we had the tea party, which went extremely well, and just trying to get people connected again, right? Just so that they don't have to experience that loneliness and isolation that sometimes come with not only, being a senior, but certainly the pandemic, right? COVID has shut us a lot in. Last thing I'm going to say from a policy perspective, we continue to don masks here at the Senior Center. We are not, I'm not from an operations perspective looking at easing that up. We did have an exposure here, but because we masked, there was no secondary exposure. So if somebody came in to a class, A couple days later, they let us know they tested positive, and there were no other positives in that class, which is exceptional. We do rapid testing for our staff, so our staff have access to, not only our staff, and I want to make sure, I should say our building. So the staff at the CAC and the staff at the Council on Aging Senior Center have access to rapid testing. So if we know that there's been a positive in the facility, then our staff get tested right away within 24 hours. That's all I have, unless you have questions for me. I want to let you know Lines and Signs put up some great signs for us. So everything that's happening, we put on boards so seniors that come in and see can readily refer to that. It's been good.
You're a busy guy.
Lines and Signs is the city of Gardner. So city of Gardner established, yep, they set up their own department several years ago. It started in the engineer's office. They would create plot plans, and those plot plans were printed by outside companies and cost a lot of money, so the engineer's office bought their own plotter so that they could develop maps for, for roadway construction projects. We mapped out all the hydrants in the city, for example, so we have GIS locations on all of them, and that project has been enhanced, and so now Lines and Signs, they do all the crosswalks, they do the parking lots, but they do all the signs you see in the parks. They do the street signs, the no parking signs, and as seemingly unimportant as this may seem, it's hugely important to us. They have been, along with many other folks, so responsive and supportive of our center. I mean, we send them a sign and they'll have it done for us within 2 days, delivered. If we need it mounted, they're mounted. So, things for our COVID clinic, directional signs, the mask signs we have up at the center, they did all those and provided us the stanchions. They're just, again, a huge support to help us get information and resources out to our seniors.
Sounds like a great gift.
They are great. I hope they watch this and know how much we love and appreciate them, because they're really good to us. That's all I have, Madam Chair.
Anything for open discussion? Yes, Terry.
I'm going to ask Terry to use the mic.
I would just like to say, once again, as I said last month, we should all be attending the various programs that the Senior Center puts on. I'm sorry, there were not, at the T, there were a couple of us. At the Apple Farm, I think there were 4, maybe I missed somebody, but I think, even if you're just an associate member, this is where you learn and meet people and appreciate the many programs and the efforts that the staff is doing. And I really, at the next affair, I hope I'll be there, the next affair, I hope to see you all. I got my eyes going.
Boy, Terry, if you're not, you're going to get a lot of flack. Can I just say something about that? And I certainly appreciate that that sentiment. Being on the board, what I hope is in the very near future we can evolve maybe to being a little bit more hands-on. And let me tell you what I'm thinking about that. When you go to an event, it's not just about having tea or having macaroni and cheese. You're hearing from the other seniors about what their needs are, what their, what in particular is troubling them, and by virtue of that discussion or interaction, you can bring it back here. And when you bring it back here, we can put a plan in place to maybe meet some of those needs. Respectfully, none of us is entirely 100% connected to every senior in the community. So it affords us the opportunity to hear, to listen, to identify, and then to enact the types of programs and services that we may be missing that could help someone. To that end, I would love for us to start doing some listening sessions. We had our first listening session with Dr. Moses Dixon, and a lot of really good things came up in that, but it was a small number of people. Maybe there were 12 folks that attended that.
And two COA people.
And 2 board, but that was pretty good for coffee. And that's kind of what I'm looking to do is over the course of the next couple of months, with your blessing and with your approval and commitment, to maybe set up some more listening sessions so that we can start to develop a long-term strategic plan for the center. So how do we better develop services today for our seniors today that are going to be enticing for the seniors in the next generation, the folks that are 10 years or 15 years out from really needing or wanting the services? And what do those services look like? And I would imagine that if we look at our needs today, compared to 5 or 10 years ago, nobody would have imagined that everyone in the community would have to be computer literate to stay connected. Like, nobody had on their radar that we would be doing Zoom meetings and conference calls as the primary way of doing business. But you saw how quickly that evolved, and so a lot of our seniors were left, you know, in the dust on that because they didn't have the technology skills, they didn't have the computer skills. Those are the kinds of things that we can start to identify today for our seniors in 5 years or in 2 years. And so I know you all have the capacity or you wouldn't be here. I welcome and encourage and invite you to maybe work with me and identify some times that would be good for you and would be good for our seniors to meet with them and hear from them what they would like us to do.
So that's a listening section.
That's a listening session.
That's it, you're listening.
We're listening, they're talking,
Yeah.
which is really hard for me to do.
I have a suggestion, because you were mentioning about when they have like the tea party and some of the other things that we've had. A lot of us, you know, people don't know who we are. And I was just wondering if there's a way to get a little name tag with someone, there is like the tea party, or there's Sean's coming and all that, and we have something that we could wear, because, you know, our names are in the monthly bulletin, but a lot of people, they don't
know who you are, yeah.
Don't have something like that.
Such a good point. And I try to develop my staff to do this as well. And I haven't always been successful, so I apologize if I haven't done it. But I try at every event to have board members stand and be recognized, even though, you know, they may not know your name. So we'll definitely work on getting board member badges. We have volunteer badges that have been made and created. We'll do that for all of you as well, so that people know you're a board member. Recognizing you as a board member may give them the impetus to take you aside and say, this is really bothering me, or I really have this great idea, or what do you think about this? So great suggestion. I also try, and I think it's really important, it's not gratuitous. I try at every event to recognize the staff. You know, we may say, well, they're paid and they get paid to do what they do. They do way more than they're paid to do. There isn't a time or occasion that I've asked them to do something that they haven't absolutely readily, you know, gone and done and done well. So they're really vested in the center. And our volunteers are unbelievable. If you haven't seen our volunteers in action, I'm going to pick on Mary for a minute because I can. I am so grateful for you and all the help that you've provided as well, and so glad to have you here as an associate member. So thank you for being here and being part of that. But each of you, when you come and help an event, make that event happen. You make it happen. And we had Ronnie out in the parking lot one day, you know, at the Templeton Fishing Game, directing traffic. There is no job we won't put you in, so don't you know, don't worry about that. And so the message to the board members are, I'm entirely 100% so full of gratitude and appreciation for all that you do. We welcome and encourage you, and you'll be put to work. I won't have you sit in a corner.
Anything further for open discussion? Now, the date of the next meeting, you will not be here, is that correct?
It is entirely at your discretion and call, folks. I will not. Lisa and I have scheduled our first vacation in 15 months, and we're looking forward to it. Sadly, I won't be here, but I can have Nancy come and give a programmatic report if you would still like to meet. So we can still set up and have the meeting, but it's totally at your, you know, at your whim. And my feeling is we probably should have the meeting. It'll be informational, a quick meeting, but it's on the calendar, and it'll give an opportunity for me to indoctrinate the staff.
It'll be quick if you're not.
Yeah. You know, Gloria, you're right. I tell people often I can't say my name in less than 30 minutes. So you're right, it'll be quick.
Where are you going on your vacation? Did you
We're
say?
going down to see my dad in Florida. Yeah, we hope.
That's good.
It's the day before election day.
It is the day before election day, so we're gonna go back to open discussion.
I'm at a meeting, when
So,
you going back?
We are openly and actively trying to recruit seniors, just so you all know, for the city of Gardner's election cycle and poll workers. So we've put out a call to folks, we send emails out and remind people those positions are open. But I want to make sure that you all are aware that we're recruiting on behalf of our organization, the city of Gardner. In addition, Haywood Hospital has reached out and asked us to pass the word around that they have screener positions open and are wicked hungry for votes. As their college students who have been working this summer have returned back to school, their staff now, they're very short on staff at the front entrance. So the screeners check people in, they assign them a tag to where they're going, make sure they're feeling good, give them a mask, and keep people who are not feeling good or aren't authorized to be there from entering the facility. It's a really important job, as is the poll worker. So if you are interested, please let me know, but pass the word. You have value, you have impact, you have influence. Let the folks in your circles know.
And the poll workers get paid.
They
and
do.
The job isn't too strenuous, but pretty much mostly you're sitting. You have to stand up once in a while and watch the counters. But pretty much you're sitting. It's a long day, but hey, you're going to get a nice little check.
You get to see a lot of people, and yeah, and you can
My
collect.
friends love it, it's very social.
It's very social. So yeah, keep in mind, we'd love to see some board members, and not board members, but you folks who are so active and engaged, take advantage of that, because it's just a great opportunity.
And also, I'd just like to say about the hospital, the positions they have there. My granddaughter just started there, and I believe they're like 40 hours a week and $15 an hour. And they're so desperate for help that they tell her, can you come in again early? She worked from 3:30 to 11, and she was there at 7 this morning. So, I mean, I don't know if you can work around you as far as how many hours you might want to work, being a senior citizen and retired. I don't know, but I've actually been thinking about checking into it.
Yeah.
They're wicked flexible, they said. I'm sorry, Ken.
What was she doing?
She's just one of the greeters, and she, asks and asks the questions, I guess, if whatever, if you've had those things, the people that always say, have you had this, that, the other thing, have you been anywhere
All
else?
those questions.
And stuff like that. She seems to like it. She says right now there's only 2 people in her position, her and somebody else.
Wow.
I'm sure some seniors would be interested in that.
It's
I
paid.
absolutely agree.
Whatever happened to voluntary? I just don't get it anymore. Everything's paid.
Yeah.
I was very disappointed when I heard that poll workers were paid.
Well, they've been paid for
I know,
years
and when I
years back.
first volunteered to do it, I was amazed. I said to the mayor, I said, this is ridiculous. It's a social, it's something your responsibility. I
Yeah.
was just
Yeah.
Just
Yeah, but
appalled.
you get-
Responsibility.
you gotta
we no
pay.
longer can do anything without being paid for it, and it's just a sad, sad thing. I mean, even here, people will say to me, well, how much do you get when you volunteer for this food bank? I'm saying, if the word volunteer, it's free. But it's sad when we have to be like this.
Yeah.
And it's just, I don't know what we're raising a generation of.
So we're clear, we are still on for November 1st,
Yeah.
and I know Kathy, you have something you want to?
No, I just want to make a copy of the attendance list, so.
Oh, sure. I want to say in closing, once again, to Maury, and I don't think we really expressed it deeply enough, but certainly to Sandy, thank you not only for your participation in the board, for taking on the chairmanship. It's a heavy ask and it's a heavy lift, so appreciate your service.
It's not that heavy.
Don't worry about it.
It's not that heavy. No, I lied. No.
Piece of cake. Are you still gonna be here?
All right.
So can I get a motion to adjourn? Oh,
I'll make the motion to adjourn.
second?
Second.
Agreement?
All right.
Thank you very much, everybody, for making my term very happy.
Everybody sign this note for Audrey.
Are you still gonna be
This
here?
is great. Thank you.
Huh?
Are you still gonna be here as a member?
No,
Oh, okay.
I'm completely off the
Well, I
board.
thought it was just the
No,
chairman.
I'm
you can-
completely off the board.
Oh,
Well, we are off. they'll probably, hopefully edit out the comments.
Yeah, no, did they tell you why I didn't show up at your meeting? Yeah, no, my girlfriend was in town.